Good morning. We are sitting at the NMC Surgical Theater and we're going to be interviewing Dr. Faouzi Safadi. We're going to learn about his technique, called also the Dubai technique. He has also received the 2018 Our Pride Innovation here in the UAE. So let's dive in because I want to get to know him. Doctor, how are you today?
Thank you.
Marhaba.
Marhaba.
Perfect. Doctor, let's start first of all about the Safadi stitching technique, which is now world known. Everyone is using it around the world. They're actually sending people from other countries to Dubai to get this technique, and you are the one who invented it. So please tell us, what inspired you to invent this technique that is changing lives?
I think in medicine, especially in cardiac surgery, it's a cumulative experience. And sometimes things come by intuition. Resolving problem is very attractive and challenging and amazing feeling in the cardiac surgery. So when we think cardiac surgery, when we are part of this environment or this technology, contributing in the improvement and the development and innovation is something amazing, and it gives us different dimension in thinking and how our devotion to this field become more and more. Sometimes frustration forces us to resolve problems. Mm-hmm. So sometimes challenge condition push us to get this effort. But at the end, it is an intuition.
Okay.
But the problem is there. More the problem is there, more the problem is not resolved. People are thinking. And we are lucky sometimes that we have this intuition to resolve it. So we know that in mitral repair, what it means mitral repair. So in cardiac surgery, we have two big parts in adult cardiac surgery. We have the blockage in the arteries, which is very common.
Correct.
And we have the valves problem, valves disease. So in valves, we have the native valves that the trend is to change when this valve is diseased or it's not functioning, malfunctioning. So we have to change this valve.
Correct.
But since 40 years in mitral, we are trying and we achieve big level of repair, but still some problem is there. And people doing repair, what it means repair? Conserving the native valve itself, but trying to repair the defect. So instead to replace the valve, we are conserving the native valve in the heart, but we are looking for this defect and we are trying to correct this defect. Then the valve become again a normal functioning valve. It is big advantage because nothing can replace the natural things.
Correct.
The native valve is something, it's a gift. It is something very too much advantage, quality of life, durability, and also risk of avoiding some medications that can threaten life, etc., etc. But it is essential. I'm not denying that we should not replace valves. It's not logical, it's not realistic. But more we are able to repair, better for the patient, for the future of the patient. It is a sign and index of high quality of care. Yeah. Because a few people in the world can reach 98% of repair. So repair can achieve in different centers 60% and 40% people change when we can save too much valves. And when we are focusing on this field and contributing in the development of the repair techniques, so we can reach higher number of repairing, and then we can save too much valve. Maybe in different circumstances we are going to sacrifice this valve. Yeah. So you see, because the valve it's like a door.
Correct.
Allowing the blood to come in one way, and when the door is closed, so the flow, the blood will not come back, in the circulation. It's a circulation like one way. When the valve is not functioning, you have the circulation is going behind. Back. So the problem was how when we are arresting the heart. Okay, because the heart, when it's pumping, everything is functioning together, like a music, harmony between valves, muscles. You see the volume, how the valve is filled, etc. But when we have to repair the valve, the heart is empty, the heart is collapsed, So the heart is arrested. So now how to redesign this valve in a way that when we are restarting the heart, when we're restarting the heart is again functioning, how we have the good surprise that the repair is successful, or the bad surprise that unfortunately this repair is not good, we have to repeat again. And how many times during an international congress and even in live transmission, hundreds of doctors are watching for this direct repairs, and we see it's normal that, yeah, sorry guys, the repairs I have to repeat, take forceps, cut the repair and repeat again. So in this now it is since 40 years, we have some dilemma in the repair, that how we can recreate the proper length of the cords, like a parachute, to regain a normal function of the normal coaptation. You see, the normal coaptation to close, because the valve is like that. So the blood comes from here, and then with the contractility, it should close. But if you have this one like that, so we don't have this insufficiency of the valve, and we have regurgitation.
Okay.
So the problem is when the heart is arrested, and we want to recreate this apparatus, this system of the valve, because the valve is not one unit, it is different units working together, and the crucial unit is the cord defining the length, and then the closure, the proper closure of the valve. So we have one chance only to get the length, to decide the length. It is very dependent of the experience of the surgeon, so it's not reproducible technique, because it is like very individual and personal achievement when a doctor is successful and well known that he can repair mitral valve.
Okay.
The other surgeon, it's not easy to adopt or to acquire this technique. My technique is getting this mitral repair very simple,
very simple,
easy,
yeah,
reproducible, and even young doctors, young surgeons can do that. So we are making the mitral repair. This club, this close group of doctors have this privilege to do mitral valve, and the rest of doctors know that they cannot do it. Now we are enlarging this club of surgeons doing mitral repair, and we can tell that in few years, inshallah, any cardiac surgeon can do mitral repair, and this is what it is our contribution. So it's in two words. So instead to have, we have one chance to define the length, like tailoring, like swing. Okay, so the most important point in the mitral repair is to create something that can adjust. So we can adjust. So when I was in the audience during international congress, and we saw in live transmission this failure of valve, and the doctor is accepting average quality of repair in the valve. So I saw the audience, and my vision go to the tie knot of my colleagues. So why we cannot create some cord that how we can adjust the length of the tie knot? Okay. You see, it's very simple.
So I see how you get inspired by how life works, but at the same time, you saw the need that there has to be a simplified way to do the repair of the valves. And that's how, again, your intuition, the years of experience, that's what has inspired you to literally, create something that is changing the world in the cardiothoracic life, like surgeons are now using it.
You see, it is just a suture. It's not just a suture. The suture cost maybe $50. The suture, okay? And with this simple way, we can do a big achievement in mitral repair. And it's not, you can imagine how important this simple thing. Sometimes simple idea is more important than too much sophisticated. So mitral repair in the Dubai technique in 2018 in the ISMICS, in the International Society of Minimally Invasive Cardiac Surgery, in Vancouver, Canada. Any year they vote for the best innovative technique in cardiac surgery, and we have shortlisted. One technique was shortlisted with one technique from New York and another one from Switzerland.
Okay.
from Switzerland. So these three techniques, one needs too much industry, other two, both very sophisticated, and we come with just this
A
stitch.
simple but yet efficient and yet life-changing.
And alhamdulillah, Dubai Technique was they win the prime.
Congratulations,
the best,
doctor.
the best innovative technique in the world for 2018. Actually, if you see now the gold standard technique in Miami Center, in Houston, in Dallas, in America, in Europe, in big centers, in Rafael Center, in San Rafael Center, in Milan, etc., too much. Now Dubai Technique is used as a standard technique.
Everywhere.
First,
Perfect.
thousands of patients that are now underwent
getting the recipient. Yeah, let's talk about that. So when you say Dubai Technique, I just want to clarify, when he says Dubai Technique, he's actually referring to the Safadi sliding stitching, which is his invention. His last name is on it, but he's so humble that he keeps calling it Dubai Technique, and yes, is well known around the world into the surgical world as Dubai Technique. But you have said, and we talked this before we were getting to know each other, how this technique is now being used around the world. And now there's other countries, when the patient needs these kind of surgeries, they're actually being sent to Dubai.
Yes.
Because here is where you are, in the NMC Hospital. This is where the technique was founded. This is who you invented it. So how does it feel to know that people around the world are being saved because of the technique you have invented?
I think that I am focusing all the time in my career for the general achievement, the big achievement, technology, and what it will remain, because we are here like ambassador. But at the end, what is this patrimony, this stuff we can leave behind us is very important if it's contributing in helping society, improving quality of care. This is. We cannot imagine how important it is when we have this privilege, this honor to contribute in the development and in the innovation of the medicine. So now people are listening to us. Yeah. So I remember when I started talking about that, big name in Europe, he thought, we don't have this habit to listen, to hear something in this region. And now they are listening to us. And it is my mission, this is my objective, not only to transfer technology, but we are able now to transfer outside. Yeah. So not only to receive, now we are able, inshallah, also with the new generation to transfer this technology, to be present in the platform, in the international platform. And all this, we have to go beyond individual achievement. We have to see like our society, because in UAE, it is a land of opportunities, a land of the people. If they have something, they can stand out with that. All facilities are here, or the condition to stand out. I invite all my colleagues to be confident, to be sure, not to be shy, even with tiny and maybe stupid ideas. Stupid ideas is the door to get big achievements. Don't be shy to think even stupid things. To
think about outside the box, right?
Yes.
Because that's how you come up with new things. I love what you said at the beginning about the inspiration of your technique is challenges that have come across is actually what sometimes inspire us to how can we do it differently. And I'm so grateful for that you are so good thinking about it. I know you're very humble, but I definitely want to ask you this. On 2018, you received the UAE Our Pride Innovation Award. Tell me, how does it feel for you knowing that a whole country is inspired to tell you that we are proud of you and your invention?
You see, this feeling, the first thing that you see, some barriers in the world exist. We have to be realistic. Barriers, feeling barriers, identity barriers, everything, society, social barriers. When I received that in UAE, I feel really I'm home.
Oh, okay.
Really, I'm home, and I recognize, people are recognizing what I'm doing. And really, my feeling is, despite the scientific achievement, I feel that it was very warm, it touched me too much to see how people are appreciating that, how they are happy with that. They are celebrating this Sada, and I feel that alhamdulillah, it's a good feeling. It's general. So maybe too much people they share with me these moments, and it is very important, very important. And I want to tell you, sustaining the achievement is more important sometimes than achieving things, because we can lose that. But alhamdulillah, in UAE, the reputation of the country, the system, the platform, this development, this progression, bring us to another level. And now we are seeing the echo of this achievement, because also we are this big advantage to be in Dubai, and Dubai is a respectable place that even when we talk in the international congress, people say yes, from Dubai, they listen.
Yes.
So see, immediately they listen. And then value is here. We start with some value and we add this value, etc., etc.
Exactly.
So I think first of all, I am happy that this is useful and beneficial for society and for the world.
Around the world. Remember, we came out that is more than 12 countries who have already adopted the teaching. Who knows by now how many more countries, but we're talking about Europe, we're talking about Canada, who are already using your technique. And even, again, we talked about this earlier, some patients are come and when they see the options, where do I go to get this kind of surgery? People are being sent to Dubai, to the NMC Hospital, because they know the success is here and you guys are making it happen.
Alhamdulillah, I am realizing that it's coming slowly but steady. We can continue with good steps that now we are receiving, at least from our region. We have too much patients coming from the other country, in the Gulf. We have receiving, but what it is also good that now still when patients go to overseas to seek for to look for some treatment in mitral repair out in Europe or overseas. Now people they are hearing from there, from Europe. No, go back. You have this service is available. And,
in Dubai, in UAE?
Alhamdulillah, yes.
Perfect. And let's talk about that, because when we're getting to know each other, I like your personality very much, because you were talking about how you care for patients. So not just in Dubai and UAE, we have great hospitals like NMC, we have advanced innovating techniques like the Dubai technique, but we also have the level of care for patients. And I'm saying this because you were talking to me that a patient earlier came to you and they were so grateful that it really melted your heart, that you were feeling emotional about it. So tell me, in your experience, how it is to work in this hospital with your team when it comes to the patient side. Do you feel like we are there for the patients?
I think when my patient, the most something I appreciate, when the patient privilege quality of care. This is the priority. I am very happy, because you see, in medicine, it is a golden rule that where we have more volume, where the team is acquiring more experience. And alhamdulillah, in all UAE, we are one of the most busy, at least in Dubai, we are number one busy center in the. So our team is exposed to too much experience, and they acquire too much experience. And you see, things seems smooth, and we have alhamdulillah over the last 3 years, we have success of surgery is by number 98.3.
Again, that's a very high number.
In the straightforward patient and intermediate risk, we have zero loss of patient, zero. And we have just some boost in the life-threatening and life-saving procedure, something desperate condition. But in the straightforward, in the regular, we have alhamdulillah 100% success in all aspects of cardiac surgery.
Amazing.
It is not because it is a teamwork. Nobody can achieve that alone. It is impossible. It's impossible, since we don't create this environment with positive energy, with this this mentality of people are thinking cardiac surgery. We cannot achieve, because it's a tiny small error and we can have big complications. So it is very sensitive. No way to have the minimum margin of errors. because in cardiac surgery,
big responsibility, doctor.
Yes, big responsibility. And we see, for example, it is normal in the lives. You see people that think some rituals. In everything, you have to, this margin to show something, high level of luxuriosity. In medicine, when people, no, I am to focus on quality of care. This team, this center can provide to us high quality of care, high quality of success. Here I am happy, so I don't want to go through the names, but I am sure our patients is coming back after being exposed to high names, high centers, etc. Still, NMC is an attractive center for this service. I am proud that we are making NMC an attractive center, safe center, with the big quality of care in cardiac surgery. It's not mine, it's well known, alhamdulillah, and I have to, yes, I am happy.
Well, you did a big contribution to the NMC, let's be honest.
I should not, why, yes, why not? I'm happy to tell that.
You're a part of the team.
The echo is coming, alhamdulillah.
Yeah, so that's great to hear, knowing that NMC more patients are recurring and coming back because of the high quality care, which again is number one. So I'm very happy, doctor, that you feel that way, that you're giving that to the people, that you're giving that to the patients. Last but not least, for young doctors who are exploring cardiology, who are exploring surgery and everything like that, and they maybe want to use your technique, Dubai technique, what would be the first things that you tell them? Like, how do you suggest the technique is easy or study it well? Because I understand now they need to study for it, and there's a course that they can actually take in order to learn the technique.
Yes. Now, it's natural. It's not we didn't decide that, but now we know that Dubai technique is it's part of the fixed program in the European Association of Cardiothoracic Surgery. Annually, we have the International Congress, and Dubai Techniques is part of the wet lab that the course for mitral repair, Dubai Techniques is present all the time.
Perfect.
So too much doctors coming to the International Congress, they are receiving this technique from this wet lab. This wet lab, led by other doctors, not by us. But from my side, how now, in the beginning, I was in contact with my colleagues, big names internationally, and I hand over, I expose this technique to my colleagues, and then it was my initiative. But then it's coming, it's spreading.
It's spreading everywhere.
It's spreading everywhere.
Yeah.
Also, regarding locally here, what we have the duty to do is to not to think in a selfish way that I can do it, it's okay. No, we have the strategy to hand over with the new generation.
Okay.
So our young doctors in the team, we have the obligation to teach him, to form him, to give him a good, not training because they are trained already, they are qualified, but to go through these innovative techniques with the tips, tricks, etc., and with the maturity. So now the most important thing is that to transfer the maturity, because cardiac surgery or any surgery, it's not a question of suturing. In suturing, we have some technicians better than doctors. But how we resolve problem, how we are thinking during surgery, what is the strategy? You see, it's different. It's different. Like, you see, something doctor has to know how to deal with everything he can by few fraction of second. Where in what we have, what step they have to see. This is the surgeon. It's not a question of suturing, because with time, surgeon become a little bit older, but they become more wise.
Wiser, yes.
More wise. And then people around him, they can do too much things, but the wiseness is there.
Correct.
And this is what we have to transfer to the new generation.
And you're doing a good job. Okay,
Inshallah.
Doctor, it's been a pleasure. To be honest with you, you are a hero. You are a very well-known and very respected person in the cardiology world and surgery, and it's been quite the honor to get to know you. Thank you so much. I think on behalf of many people, on behalf of many lives that you have saved because of your innovational technique, I say thank you.
Thank you for
Thank you.
this
Shukran,
interview.
Doctor.
Thank you for this opportunity.
Perfect.
Thank you very much.